So coming to the conclusion of today's what you say lecture, what I feel is Viddhakarma and Agnikarma is boon to Ayurvedic fraternity, especially those who are practitioners. So when done accurately, it acts like a catalyst in a chemical reaction and helps healing very faster. In chemical reaction, there is a catalyst which makes the chemical reaction to go faster. Similarly, when Viddhakarma is adopted, it gives the healing very much faster, and it should be done till Puriyat Yavat Atandrita. So till you are tired or till the patient is tired, till you get the result, it should be done continuously without any lag in between. So on an practice, minimum of 3 sittings needed to see slight changes in chronic cases. Chronic cases like Rudrasi, Janushula, minimum of 3 sittings. It might be morning, evening, and next day morning, or 3 consecutive days. Usually, we suggest morning and evening after a gap of say 6 to 8 hours, so that the healing is more faster. But in the practice, we see that patients come from very far, where they are not able to take 2 sittings in a day. So I personally advise, or my sir advises them to come at least thrice a week, and you will get the results again in those patients too. Then in acute conditions and in emergency condition, it is having fast effect. So as I told, in Udarashula, where there is a severe pain, just by one sitting of Viddakarma, the pain comes down. Not by 100%, I'll tell, but at least by 40 to 60%. With one sitting, it comes down. And Viddakarma can be done every day, unlike Rakta Mokshana. Rakta Mokshana needs a gap. Every day you can't remove such huge amount of Rakta every day. So that is one drawback where Rakta Mokshana is having. But with the karma, you can do it every day. And what I feel is every Ayurvedic Vaidya should learn this skill of doing Viddhakarma and Agnikarma on their patients. So I thank you. Thank you, team Ayur Srishti, for inviting me to give this talk. Thank you, everyone. And this is my contact details. If anyone wants to contact me or any doubts further, can contact me. Thank you.
Thank you, sir. Thank you for sharing your insightful experience on the topic of Vidya Karma and Agni Karma. So, we are overwhelmed with your talks, and now the session is open for question and answers. So, it will be open for only 5 minutes. So, those who have your questions can ask this, sir.
Yeah.
Namaste, sir. Good evening.
Namaste.
Sir, what can be the possible treatment in cases of cervical spondylosis or lumbar spondylosis or in cases of severe low back ache?
Yeah, sir, I told, right, whenever you having lower back ache, especially we have to first locate the region. Say, suppose from L5 to S1, or some people will be having L2 to S5, something like that. So in that particular regions, in paraspinal area, paraspinal muscles are there, right, in the back. I'll just go to that particular slide. Wait. Mm. Yeah, this one. So my cursor is visible, right?
Yes, sir.
Yes, sir. It is
Yeah.
visible.
Yeah. So here, say this is anterior superior iliac spine, and if we draw line like this, so this particular region will be L5. So 2 angul is above that, L4, L3. So like this, these vertebrae will be seen. So 2 angul is from the side. So here, this particular line, I'm sorry for the crooked lines over here. here and here. 2 angulis of the patient. If you take 2 angulis on the parallel side from the midline, and it should be in between the two vertebrae. Take some other color. Wait. Yeah. It should be in between the two vertebrae. So this point, this point, this point, this point. If it is in L5 and S1 region, pain, low back ache. So if it is in L2, so you can palpate the L2 vertebrae, and in between L2 and T12 vertebrae, you should do with the over there 2 angular side to the midline. That is exactly on the paraspinal muscles of the particular patient. So over that you should do with the karma. So on this point. Am I clear?
Sir, yes, sir, you are clear, but I'm very happy to actually talk to a perfectionist who has been already doing Agnikarma and with the karma, and you are already giving mind-blowing results to the society, sir. I'm very happy to find a young generation like you. But my
Yeah.
curiosity is that, sir, when there is when there is suppression, when there is a disc bulge, or when there is anatomic anomaly, and when there is a
Yes.
disc slip or bulge, whatever anatomical deformities has been formed, how
Yes.
can it be treated merely giving Agnikarma with the karma?
Sir, basically what I had seen, like the case which I had shown, the patient who had come walking to my clinic, he has having a disc prolapse actually. Frankly speaking, there is a disc bulge, and one of the disc, I guess in L4 to L5, there is a prolapse. But the pain has reduced in such a way that he was having, due to the pain, he was having scoliosis. There was a deviation in his spine, but now his spine is erect. The thing is, mainly in initial days, it may take, for few patients it may take 2 months, for a few patients it may take 6 months. In initial days there is a drastic change in pain, and later if you continue, it might take around 1 year also. If you continue, there are healing changes seen in the disc prolapse. I had seen MRI of patients while I was working under my guru, Vd Chandrakumar Deshmukh sir, where the disc has come back to its normal position. This only happens when you do it properly to a particular amount of time. Say 6 months, 8 months, 1 year, 1.5 year, it varies. Again, person to person, it varies. So that basically, whatever if we see according to Ayurveda, Rakta has a Jivana karma. It has a property to heal. So basically, we are playing with that property of that Rakta Dhatu, which heals the disturbed system in our body, is what I feel, sir. But within the span of 2 to 3 months, the complete pain will be subsided. And if the patient still discontinues in that particular point of time, for next 4 to 5 months, the pain won't reoccur. Condition that he is not straining himself with strenuous work. But if we continue till 1 year, 1.5 year, definitely there are changes seen in the disc prolapse or else a disc bulge. We see the changes in that.
Thank you so much, sir. I'm highly
Yeah.
convinced by your answer.
Yes.
And ये बोलने के लिए it needs lot of experience and a lot of guts, because anatomically जो defect हो चुका है, again it is coming back to its original place and it is giving the result. ये
Yes.
बोलने के लिए सच में experience चाहिए.
Yes. Yes.
And
Actually, एक और केस है सर, like I have one case where laborer who had fallen down and 8 years ago, and he was having patellar dislocation, and he was advised to do surgery, but he neglected it. And now he's coming to me since 2.5 years. So now the patella is been coming to its original place, wherever it has to be, and the limping rate of that particular patient has drastically reduced. So that is the wonders which this treatment is doing. Yeah. Any other doubts?
Sir, I have
Hello.
good evening, sir.
Yes.
Hello. Sir, I have one question.
Yes.
Sir, is that Viddakarma is useful in all Kesha rogas like Kalitya and Palitya? Whether it
Yes.
is
Yes.
curable?
Yes. Yes. Especially in Palitya, sorry, Khalitya, the hair fall within 2 to 3 sittings, there is a reduction of the amount of hairs falling. Almost 80 to 90%, there will be a reduction in the complaints. Even in Palitya, there are again Palitya along with internal medications, where looking at the patient's nidanas, we have to prescribe the internal medication, and the along with that, viddhakarma should be performed. So based on that, the results are seen. So it is done mainly on the 6 points on the scalp. If we see the Brahmarandra, which is here, right? I'm showing out on myself. I don't know whether it is clear to you or not. So here, so from
It is
here,
clear, sir.
yeah, from here, 2 angulas side, 1, 2, 3. So these 6 points with the is to be done. And when we see anatomically, there are anastomosis of the arteries over there. Anastomosis of the particular blood vessels in that particular in the skull. So when we do rakta mokshana over there, naturally when we see like after, say if there is a severe hair fall or baldness seen, it takes somewhere around 3 to 6 months to grow the hair naturally. And wherever there is a loss of hair, drastical loss of hair, it can be subsided within a week or 2 weeks. The results can be seen. This I have personally experienced when I was learning at Sir in his presence. So I was experiencing hair fall as my routine got shifted. I was doing Ratri Jagarana because his OPD was till 12 a.m. till 1 a.m. So I was doing that, and more of Vata increased and my hairs were falling. So I used to take Vidha from Sir. After every patient he sees, we all students used to take Vidya based on our complaints. So I used to take Vidya for my hair fall. So within 2 to 3 days, without any internal medication, the hair fall quantity was drastically reduced for me. It was my personal experience at that. So it works on Khalitya as well as Palitya.
Thank you, sir. Thank you so much.
Yeah.
Hello, sir. Namaste.
Namaste.
Sir, have a complete ACL and ligament tear. Complete ACL and meniscal tear. Meniscal
Yes.
is partial. So,
Yes.
I have taken one Agnikarma session.
Yes.
But still, I think it is not proper. I have taken from you locally. Can it be
Yes.
cured completely, sir?
Yes. Cured, yes, again it can be cured completely, but again every day for say around 2 to 3 months you need sessions,
Okay, sir. Okay. Right
because
now,
one patient I had, he during while learning under Sir, he had given it to me to take care of that particular patient. He had a meniscal tear while playing cricket. He had dive. He had to dive to take a catch, and after that he got hurt on the knee, and after the MRI scan, everything, he got to know that he had a meniscal tear, ACL tear was there, I guess. So his complete responsibility was given on me by my sir. So every day Vidyakarma, Agnikarma, and in between we used to do Snehana and Svedana, like local Abhyanga and Svedana, Nadi Sveda or by Tapas Sveda. So within 2 days, a person who was not able to walk, sorry, 2 months, he came riding his own bike to the clinic. Yes, of course, complete healing was not yet done, but he was in such a condition that he was able to ride his own bike. So that healing we have seen.
Okay, sir. Thank you, sir. I have another doubt. Like in our infertility cases, does Agnikarma works?
Yes, it works. Especially when there is no ovulation, anovulatory cycles. There is Agnikarma done with Vriddha Churna. Dhupana Agnikarma, it is told. Wherever, like I had told, the nerve supplies in my lecture, the nerve supplies which supplies the ovaries. If we do Dhupana Agnikarma, nothing. Just a second. So if this is a paper, we have to just roll it, just place churna, like Vriddhadaru churna on in one end, and we have to keep that particular end on that particular nerve root and just burn from this end. This end. The churna is this at this end. This is in contact with the skin, and we have to burn it, burn the paper from this end, and we have to burn until the patient tells that yeah, I am feeling the temperature right now. Then we have to take it out. So with that, just one sitting, the patient who was not having ovulatory cycles, her ovulation was seen after 2 days. Even after giving many panchakarma sittings to her, like sir tried virechana, sir tried even vamana. All panchakarmas were done in that particular patient. But when after giving this particular Rupanagni karma, she got her ovulatory cycles. So Agnikarma and Viddakarma both plays a role in infertility. Again, in infertility, there are various reasons why the infertility is happening. So basically, you have to trace that particular reason and treat that reason. For example, again, there was one case where she was diagnosed infertility, but the main reason was amla pitta. She was having severe burning sensation, and the udara shula she was having. So, sir, rather treating on the focusing on her reproductive organs, sir focused on it on the amla pitta, which was severe. And once that was taken care of, she immediately got pregnant. So such way we should treat. Not only there is again in Vidyakarma there are no specific points for particular disease. We have to see the samprapti and that particular specific point we have to do Vidyakarma. Or else randomly doing Vidyakarma is of no use.
So if you want to study Agnikarma and Vidyakarma in depth
Yes.
more, then what are the perfect sources of materials, references?
Source of material is one. There is one book which R.B. Gupte sir has on his name. It has been published. You can get it on Vaidya Gupte Memorial Foundation. If you type it on Google, you can get on that. And one more thing, only the bookish knowledge is not important, sir. I would like to tell if you can go for a few months or 1 or 2 months minimum to see how it gives the results and how and where to pinpointly do with the karma, you have to see, or you have to see in that patient, because this book will give knowledge, but experience also matters, is what I feel. Because what I used to do is, I had got this book during my MD, so I used to read this and try on the patients, but that much of result I used to not get. But once after my MD, I went to sir. I took training under him. After that, I got that particular confidence, and now I am able to convince patient to take with the karma sittings. I am able to give result to the particular patient. Like yesterday only, I had got one lineman who does electrical works for the government. He was having severe pain in his elbow joint. I told, like, he was not able to lift anything. So I told, I'll not give any medicine. I'll just prick you at particular places. And I just did with the karma over 2 angulis above Kshipra and above Bhavaka with them. And after that, he told, sir, 80% of my pain has gone. How did you do? Is there any medicine put it in the needle or anything in the needle or something? I don't know, but 80% of my pain is gone. So that confidence you will get when you learn under some guru, is what I feel. And if you want to see that like if you want to feel that confidence, I would like to announce one thing, that on 12th of coming March, 12th of March, there is one camp, which is the largest camp of Agnikarma and Viddhakarma, held in Dehu near Pune, where more than 500 plus doctors visit over there every year.